Hello, my name is Nilofen Batoon. I'm the team leader of this research study.
I am Angela May Baloco.
My name is DJ Vandus D. Cañada.
I'm Jerica Bonete.
Joey Margaret D. Aurelio.
Today we will be presenting our research paper entitled An Uphill Climb, the Lived Experiences of Emergency Room Nurses on Stress.
Introduction. Among the various health professions, nursing is known to be a career that is particularly susceptible to stress. Occupational stress has been a health-related issue among nurses for many decades. Emergency department nurses are frequently confronted with occupational stress in their workplace. These encounters can make them feel more stressed than other nurses in other departments. Being a nurse in 2021, specifically a Negros Occidental emergency room nurse, has a large number of implications. Being an emergency room nurse in the modern day often entails dealing with being understaffed, underpaid, overworked, and impacted by the ongoing COVID-19 pandemic. Statement of the problem. The study aims to explore the stress-inducing lived experiences of ER nurses of Negros Occidental. Significance of the study. The study may be significant to the following: hospital administration, professional nurses, student nurses, and future researchers. Theoretical framework. Lazarus' theory of stress and coping explains the relation between stimuli, the individual's perception of stimulus, and the coping strategies. How the nurses see and approach these stressors will be a part of their everyday experience in the emergency room. Their perception of these transactions will determine the outcome of their experiences. Betty Newman's systems model explains a person's relationship and response to stressors in their environment and the dynamic factors of coping. The study explored how the nurses describe their experience, their ways of coping and handling, how they end their day in the emergency room, and continue their responsibilities the next day. Conceptual framework. The tasks required from nurses, demands of patient care, relationship with the team, over workload, and support from the institution should be taken into account. The work environment and tasks have to be established to get a grasp of what it entails to be an ER nurse that would somehow explain their lived experiences.
Methodology. Research design. This study is a qualitative phenomenology study. The unique perceptions and experiences of these nurses were important and the main source of the data and information for the study. Study participants: 5 to 9 current emergency room nurses employed within Negros Occidental with an experience period of at least 1 month. Research instrument. A researcher-made questionnaire was utilized to gather statements and data from the participants during an interview time, which was set and established after the signing of informed consent. A qualitative profile was established: the age, sex, number of years, or months in experience. A set of questions were utilized to gather statements and data from participants in relation to their lived experiences in the ER. Ethical considerations. Ethical values were strictly followed throughout the course of the research. Confidentiality was ensured through the changing of participants' names into aliases. Informed consent forms were provided to participants to sign before participating in the study to ensure they understood the study and to provide ease of mind that any and all sensitive information would be deemed confidential by the research team and treated as such.
So for the results and discussion, there are three major themes that were identified. Number one is skill and characteristic demands of the ER. Number two is occurrence of stress in the ER. And number three is the impact of the pandemic on ER nurses. So for the first theme, we have two sub-themes. And the first is what a nurse needs in the ER, skills-wise or otherwise. Our first participant, Riley, stated that I would try to tell you generally that being an ER nurse is really not an easy job. You really need to have these three things: knowledge, skills, and attitude. I think the most important one is the attitude. Our other participant, Glory, stated that first, you need to be mentally ready because every day you encounter lots and lots of accidents that comes out of nowhere with reason or no reason at all. So you need to be mentally aware about yourself for you not to indulge yourself too much in the situation. And next, we need to be physically prepared because you run and run and run. For the next sub-theme, difficulty of being employed in the emergency room, participant Glory stated that as she was a novice nurse in ER, it was very hard and she encountered lots of struggles in performing procedures and using machines, but with the help of her seniors and colleagues to figure things out, she has the confidence that she will be fully equipped in the future. We also have participant Katie saying that it really demands high level of skills, intelligence, and it also demands your patience. Like for example, you would give your very best in all aspects of nursing skills that you learn. Onto the Next main theme, occurrence of stress in the ER, and same with the first main theme, it also has two sub-themes. For the first sub-theme, participant Fran stated that stress maybe is a part of our lives, but as a nurse, maybe it's our sisters and our brothers already. Even if we go to sleep, our mind is still at the working area. There are times that you are like, have I done this? Did I forget something? I think I haven't done this. That's how you like think in that kind of situation.
Subtheme 2b, stress-inducing situations in the emergency room. As we can see, Riley 29 states that why is it at the ER, or being a nurse as a whole, why is it that stress is intertwined with our profession? It is because imagine a person comes to you breathless, pulseless, or in a critical condition, so that person is already at the verge of breaking down physically. In essence, she states that the nature of patients admitted into the ER results in stress on the nurses because they must be ready to address and deal with breakdowns of all kinds while caring for their patient. Moving on to main theme 3, which is impact of the pandemic on ER nurses, we have subtheme 3a, which is newfound experiences in the ER in relation to the occurrence of the COVID-19 pandemic. Glory 22 states that pre-COVID, we accepted all patients, no questions asked. Now we need to decrease patient count and we need to be more keen when it comes to triaging, and the anxiety will always be there when it comes to interacting with patients. In essence, she states that the COVID-19 pandemic has resulted in just another worry that ER nurses have when it comes to admitting and assessing their patients. Moving on, we have subtheme 3b, which is the impact of COVID policy and protocols implementation on ER nurses. Fran 22 states that during the pandemic, we are just having protocols. Our policy is that all staff nurses should report on duty, I think, 10 minutes before the time in. She goes into detail about how now, even before they are able to enter the ER to begin their shifts, they now must go through a screening process to ensure that they are not positive for the virus. Moving on to the discussion. After gathering and being able to analyze the statements of all our participants, the researchers believe that they are able to form a variety of tentative conclusions. Some of these being working in the emergency room is just naturally a difficult place to work. Knowledge, skill, and awareness were identified by participants themselves as needs when it comes to working in the emergency room. The emergency room is naturally a stressful environment, and stress will simply always be present. On top of this, nurse-patient interactions were often a source of stress. COVID-19 has impacted the way in which ER nurses approach work and how their work impacts them as well.
Conclusion, working in the emergency room as a whole is not an easy task. Now one must be properly prepared and proficient in a multitude of skills in areas in order to adequately provide care to those being admitted to this specific ward. Despite this, the participants of the study never seemed to waver in their commitment to becoming quality nurses. On top of this, stress, the same way it is present in our everyday lives, is present while working in the emergency room. The current COVID-19 pandemic has also added to the tension that these nurses are experiencing, with all the participants being able to go in detail about how the pandemic had affected their lives, personally and professionally. It is with that all frontline nurses should be applauded with the courage and strength they possess in order to face the challenges they encounter the day in and day out, not only serving the patient but the population as a whole. For our recommendation, providing nurses as a proper means of coping with their stress, or allowing nurses to distress should they believe to be overstressed, are potentially important steps in combating the prevalence of stress in nurses in the ER. Potentially, increasing the amount of participants even by one or two participants could have profound effects on the results of our future study. Expanding the boundaries in which participants are pulled from in the future may present a more diverse and eye-opening set of results in terms of the experiences and statements recorded by those participants. Changes such as location of the study changes, alteration in the interview process, and even possibly the conduction of the study in the post-COVID times may all serve to alter, improve, or diversify the results in the study, aiming to accomplish the same goal as the research study. So these are our references.
Lastly, our acknowledgements. First and foremost, praises and thanks to God the Almighty. We, BSN 3E Group 1 Second Half, would like to express our deep and sincere gratitude to our research supervisors, Ms. Christine Acanto Condes, Sir O.J. Balestros Jimenez, and Dr. Sheila Magbanua Trajera for providing invaluable guidance throughout this research. Their sincerity, drive, and motivation have deeply inspired us as a group to work as one, as a unit. We are also thankful towards the participants of this study, for had they not agreed to our devoted time towards interviewing with us the research team, this study would not have been possible. We also extend thanks towards the panel for taking time out of their schedule for this defense. We are grateful to our parents and families for educating and preparing us for the future.